The dental surveyor is a paralleling device which has many uses in dentistry. The purpose of surveying the diagnostic cast is to locate surfaces that can function as guiding planes, to locate areas which may be used for retention of the partial denture, to locate interferences to the path of insertion, and to maximize the aesthetics of the partial denture. The partial surveyor consists of several components. The survey table has a locking knob that permits the table to swivel. Another knob allows the cast to be secured to the table. The platform, the vertical arm, the horizontal arm, the vertical spindle, a set screw allows the vertical spindle to move up and down. A small mandrel allows the survey tools to be secured within the vertical spindle. A compartment contains extra tools. The surveying tools consist of an analyzing rod, a carbon marker, and a metal sheath to house the carbon marker to prevent it from breaking. The wax cutting tool is useful for carving wax for simulating tooth preparations. Undercut gauges consist of the .01 inch undercut gauge, the .02 inch undercut gauge, and the .03 inch undercut gauge, as shown in the diagram. The base of the cast should be flat to facilitate placement on the survey table. The cast is secured with the locking knob. To begin surveying, the occlusal plane of the cast is level with the table, that is, at a 0-degree tilt. The cast may be tilted anteriorly. The cast may be tilted posteriorly. These two movements are useful in locating the appropriate guiding planes. The cast may be tilted laterally, right or left. These two tilts are useful in relocating retentive undercuts. How to survey the cast. To begin, secure the analyzing rod to the vertical spindle. Loosen the set screw to allow the vertical spindle to move up and down. Examine the proximal surfaces of the abutment teeth for potential guiding planes. Examination of these surfaces can give an indication of the degree to which the surface must be modified in order to achieve parallelism of these abutments. Next, examine the facial and lingual surfaces for potential areas of retention. The analyzing rod demonstrates a small triangle of light, known as the angle of cervical convergence. This area is useful for retentive purposes. Examine the cast for interferences to placement in hard and soft tissue undercuts. The example demonstrates a bony exostosis, which may interfere with the placement of a clasp or denture base. Occasionally, with undercuts of this nature, a path of insertion may be established to avoid this undercut area. However, this may have unintentional effects on the other abutments or guiding planes. Finally, the partial denture should be examined for aesthetic effects. Embrasure spaces should be eliminated or evenly spaced when possible to provide a more aesthetic result. Spaces may be eliminated or reduced or modified by tilting the cast. Alternatively, spaces may be eliminated by tooth preparation. In the example diagram, the upper diagram shows how an embrasure space may be modified by tilting the cast. This is especially true in the anterior area, where excessive guide plane preparation will be unaesthetic. The lower half of the diagram shows this effect in the anterior area. That tipping the cast may produce a more aesthetic result and give better conservation of tooth structure. The undercut gauge is used to measure the areas of potential retention. In this procedure, the shank of the tool will touch the height of contour. The nib is then raised until it touches the tooth. At this point, .02 undercut exists. The surveying procedure may be repeated several times to find optimal locations for guiding planes, undercuts, aesthetics, and avoidance of interferences. After surveying for guiding planes, retention, interferences, and aesthetic, you will draw the survey line on the tooth, marking the height of contour. Support the carbon marker with the metal sheath and place them in the mandrel. Secure them to the vertical spindle. The survey line is drawn on each abutment tooth. Notice in the example, the survey line is being marked for the entire circumference of the abutment tooth. In addition, the example shows marking the height of contour of the bony exostosis, which may provide an area of interference. The illustration now shows the heights of contour have been marked on each abutment tooth, as well as the bony exostosis. Once the surveying has been completed, it is important to mark the relationship of the cast to the surveyor. This procedure is known as tripoding. In one method, 3 vertical lines are drawn on the base of the cast, parallel to the path of insertion. The marks are widely spaced. Alternatively, lock the vertical spindle of the surveyor and draw 3 widely spaced dots on the inner surface of the cast as shown in the illustration. This method requires that the vertical spindle be locked. Circle these 3 marks in red pencil to distinguish them from stray carbon markings. You are now ready to proceed with designing your partial denture. The cast may be removed and replaced as necessary. Review the steps of surveying. First, secure the cast to the table and the occlusal plane is level with the base of the table. Next, examine the proximal surfaces for their use as potential guiding planes. The cast may be tipped anteriorly and posteriorly to give the best alignment, which results in better conservation of tooth structure. Next, retention areas must be examined. The height of contour and thus the area of retention may be altered by tipping the cast laterally. However, undercuts must be relative to each other. Examine the area of undesirable undercuts. Buccal exostoses in the maxilla and lingually tipped premolars in the mandible are very common areas where this will occur. Examine the cast for aesthetic concerns. This is particularly true in the anterior case. Altering the path of insertion can give better tooth conservation and better aesthetics. Once these basic steps have been performed, mark the height of contour with a survey line. Lastly, tripod the cast to preserve the orientation of the cast relative to the surveyor and the path of insertion established. Do this with 3 vertical lines or 3 widely spaced dots. Now that you have completed the surveying, you will be able to apply a design to the partial denture. You will be able to plan tooth reductions with respect to guiding planes, axial reduction, and rest seat preparation. You will be able to plan your clasps and your major connector placement. It is very important to recall that your partial denture design must work with the patient's existing occlusion. Therefore, you should re-examine your design on a mounted cast to ensure its adequacy.